Good evening, folks. This evening's topic B is discussing the world of dementia. When a loved one is diagnosed and the whole gamut. So here we go with the presentation I made for you. Sit back and walk with me through the world of dementia. Here we go. Dementia is a progressive loss of cognitive functioning, including memory, reasoning, language, and decision making, severe enough to interfere with daily life. It is not a normal part of aging, though aging is the strongest risk factor. What is dementia? Or what dementia is? Dementia describes a set of symptoms, not a single disease. It occurs when the brain cells, neurons become damaged and lose their ability to communicate, leading to declines in thinking, behavior, and independence. Alzheimer's disease is the most common cause, responsible for over 60% of cases. Key symptoms. Now, guys, these are very important so that people can distinguish what their family member, what stage they're going through, what phase of dementia that they're dealing with. And remember what I said in previous videos, folks, about there's 5 stages of dementia. So you have to figure out which one your loved one is going through. Okay, so here we go. I'm going to explain each one for you. Symptoms vary by type, but commonly include memory loss, which is confusion or difficulty learning new information. Language problems, finding words, reading, writing. Impaired judgment, difficulty with daily tasks. Behavior changes such as agitation, anxiety, hallucinations, or sleep disturbances. Movement or balance issues, more common in Lewy body or vascular dementia. Okay, now here we go with the major types of dementia. Okay, I'm going to go through those for y'all. Give me a couple seconds, please. Okay, first one, Alzheimer's disease. Most common, associated with amyloid plaques and tangles. Vascular dementia, caused by reduced blood flow or strokes. Lewy body dementia involves abnormal alpha synuclein deposits. Frontotemporal dementia affects behavior, personality, or language. Then you have mixed dementia, a combination of 2 or more types. Causes and risk factors, NIH, NIA, NIH.gov. Dementia results from damage to brain regions responsible for memory and cognition. Causes include neurodegenerative diseases, Alzheimer's, Lewy body, FTD, vascular injury, stress, thyroid disorders, or medication effects. Some irreversible. Risk factors: aging, family history, cardiovascular disease, diabetes, high blood pressure, head injury, and smoking. Latest research highlights. Circadian rhythm disruption. Many may accelerate inflammation in the brain, potentially worsening dementia progression. Biological age versus chronological age. Faster biological aging significantly increases dementia risk, especially in people with high genetic risk, e.g., APOE4. Combining genetic markers, biological aging may allow earlier detection through simple blood tests. Diagnosis: doctors use cognitive testing, blood tests, brain imaging like CT scans, MRIs, PET scans, things of that nature. Okay. Review of medications and medical history. Treatment and management. There is no cure for dementia, but treatments can slow progression or improve quality of life. Medications. Choline inhibitors. And anti-amyloid therapies for early Alzheimer's. Lifestyle, physical activity, social engagement, cognitive stimulation. Managing health conditions, blood pressure, diabetes, thyroid, vitamin levels. Dementia describes a group of brain disorders that cause progressive decline in memory, thinking, and daily function. The major types are Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal lobe dementia, mixed dementia, National Institute on Aging and CDC have more information for you folks. Major types of dementia. Below are the most commonly recognized types with a one-line hallmark and a short note on typical features. Alzheimer's disease. Most common cause of dementia, progressive memory and thinking decline. Typical brain changes include amyloid plaques and tau tangles. Symptoms often begin with short-term memory losses and progress to language and functional impairment. Alzheimer's Association, National Institute on Aging. Vascular dementia caused by reduced blood flow or strokes. Second most common type. Symptoms depend on the brain areas affected and often include stepwise declines in thinking, slowed progressing, and executive dysfunction. Risk factors overlap with cardiovascular disease. CDC, National Institute on Aging. Lewy body dementia marked by abnormal alpha synuclein deposits. Lewy bodies key features include fluctuating attention, visual hallucinations, REM sleep attention, REM sleep behavior disorders, and Parkinsonisms.